My name is Dr. Farrukh Alam. I am the Medical Director at Harbour, London, and I oversee all the clinical provision of treatments for the entirety of people coming into Harbour. One has to respect that people come from different cultures, different beliefs, their perspective on the world may be different to someone else. With the Arab nations particularly, it's important to acknowledge that the family play a central part in their treatment and perhaps the effectiveness of treatment. Stigma, and this is not just in the Arab states, but around the world, mental health, addiction is highly stigmatized and often leaves the client feeling embarrassed or ashamed. And that needs to be considered more carefully on how we manage that stigma, not just coming into treatment and the need for privacy and discretion, but also at the time of aftercare, when they're returning to their home country, how that stigma may affect them, how to keep a discreet way of treatment continuing through medication, therapy, without breaching their confidentiality and allowing any stigma to creep in. So Harbour's approach to cultural sort of sensitivity is we acknowledge that the family play a central role, and often not involving the family leads to ineffective treatment, particularly as when people are in treatment with us in London, they will be returning home back to their family and community. And so sort of psychoeducation of the family will be an important part of the treatment, not only in what is happening during treatment, but more emphasis on when they return home, how the family can provide support, but also look for any signs of sort of psychological distress or relapse. Now, particularly with clients from the Arab nations, religious, cultural sensitivities may be there, but it is important that the language we use has to be congruent. So using terms like mental illness may not be that helpful, rather than talking of stress or exhaustion. And that language can be more helpful. What we have to do, and what we must do, is acknowledge that the treatment we provide may need to be changed. An example of this is cognitive behavior therapy. It's a well-evidenced, well-recognized psychological therapy, but that can be sort of integrated with more religious or coping spiritual beliefs such as prayer. So we are able to sort of amalgamate different types of treatment to actually suit the client. When it comes to aftercare, people returning to their home, we have a very wide network of specialists working internationally, and particularly in the sort of Arab states, that we would then allow continuity of care with a local person, a local therapist, a local doctor. And so often we can tap into those resources to provide congruent treatment. Now, when needed, we can have a hybrid of telehealth as well as a local provision. And that's one of our strengths.